Hello, I'm Hartford Healthcare's Tina Verona. When you realize your aging parents need help, but you don't know where to turn, it can be a difficult process trying to figure out what's best for their needs. Karen Pagliaro is the Director of Government and Community Relations at Hartford Healthcare at Home, and she's here to get you on the right path. Karen, good evening. Thank you so much for joining us. We appreciate it.
Thank you.
Well, this is an important topic, and it's a challenging one, I think, for people who have aging parents, who might be heading down that path, and they don't know where to begin. Where do you begin?
I think you always need to begin with a discussion with your parents, because you need to find out how they feel and what their needs are and what they think about what their situation is. But then after that discussion, there's so many opportunities, and luckily Hartford Healthcare has them available for us.
And what you find, and I thought was interesting when we were chatting earlier, was that many people wait and they put this off until the last minute because it can be overwhelming.
Exactly.
And there are so many programs out there to help. And like you say, knowledge is key, and start doing it early.
Exactly.
When do you start? When should you start?
I think that you should start whenever you see your parents starting to have even very minor declines. Do they need help with groceries? Do they need help with meals? Are they able to keep their house clean? Are there piles of items on the kitchen table because they can't bring them down to the garbage or to the recycle bin? Are they doing okay with finances? I'll never forget my mother having a money order and whiting it out, and that was one of our clues that she had something else going on. So you have to be intuitive in looking at where are the deficits in your parents and what you can do to help.
And you know, now that the holidays are upon us and many adult children are coming home to see their parents, maybe the first time in months that they've seen them, and they're not around them, so they're really not in tune with something that might be a little bit off. What should they be looking for as they head home for the holidays and maybe see their parents for the first time in months?
Well, are their parents walking well? Are they walking with holding on to the furniture? Are they having problems making it to the bathroom? Are they sleeping well? What are they saying? Are they giving you clues, verbal cues as to what the issues are? And I think one of the problems is you never really realize about home care until you really need it. And typically when you need home care, it could be precipitated by a crisis. In other words, your parent has fallen, has gone to the hospital, and then comes home. So having those discussions ahead of time is very, very key.
And you want to do your homework too, because you want to make informed, educated decisions. You don't want to make these decisions when you are in a crisis and you're not in that right frame of mind, and you might not choose something that might be the best. So you really want to have the time and carefully think this process through.
Absolutely.
And there really is programs for every type of scenario. Let's sort of address some of those programs that Hartford Healthcare at Independence at Home offers.
Okay, so with Independence at Home, we have programs that you can do like our Lifeline service. So it's that I've fallen and I can't get up. Well, we have a program that you can have one installed, and it doesn't matter if you have a landline or if you have a cell phone. We have the programs to meet your needs. So that's one thing. We also have private duty aids. It can be just 2 hours a day to help somebody take a bath and then do their laundry, somebody for errands, whatever you need. Hartford Healthcare at Home's Independence at Home can help. And it's a great thing. And the other thing is, when you have a private duty company coming into the home, you want to be sure that those people that are going into the home with your elderly parents, that they've been vetted. And that's one of the things we do. So be informed when you make a decision on bringing somebody home into the house.
Absolutely. And this doesn't have to be a process that weighs heavily on your shoulders, because there are folks that can help you with a home assessment so that you're not trying to figure out, okay, what do they need? What's wrong? What do I do? We have folks that can help with that. Talk to us about the home assessments and what that involves.
So we have two different things that can help. Our first is our Center for Healthy Aging, and that program has really grown. There's a lot more of the centers around our state, and we can do an assessment in your home. It's free, and the assessment can look at a wide variety of needs for your parents. It's free. It's confidential, and it can help you make an informed decision about the care you need. The other program we have with Hartford Healthcare at Home is our care transition nurse. We have 3 nurses right now. They are absolutely fabulous, and they can come out to the home. So say you have somebody and you're not sure, do they need home care, do they not need home care? Our nurse can come out and do an assessment in the home and then really make those recommendations. You know, yes, they need certified home care, and here are your options. Or, you know, they might just need care with this, and these are some referrals that we can make on your behalf. The best part, it is a free service, and the nurses, as I said, are wonderful.
Yeah, something definitely to take advantage of.
Exactly.
Well, how should you prepare for a home assessment? If you have one coming up, how should you prepare your parents, or should you be there? How should you prepare? What can you expect?
So I think that it's always good if you are able to be there with your parent. It's really quite wonderful to have somebody there who can also listen, because sometimes a person can be a little nervous about having a stranger coming into the home. The other thing is all of your parents' meds should be out and available. And the nurse that makes a home visit may ask to see your kitchen, may want to have you walk because they want to assess how well you walk, may have to see you walk into the bathroom and then be able to sit on the toilet, but you know, clothed obviously, but just to give an idea, can they get up? Can they actually toilet themselves without falling? Are they able to do stairs? But definitely getting out your insurance card and your medications is really key and very helpful when somebody comes to the home.
And probably medical history too, to have all of that readily available.
Exactly.
The word independence, that is probably the most challenging part of all of this. And you know, when you have aging parents who are not ready, who are stubborn, they don't want to give up that independence, that's crucial. I mean, you know, especially if you have parents who have been independent their whole lives, they're driving, that's not easy to give up.
No.
How do you navigate those waters as an adult child to say, hey, you know what, it might be a good time to put the car keys away?
So that's a very hard decision, because I think that driving your car truly means that you're independent and you're able to do for yourself. You could have a conversation with your parents' doctor, and I will be honest, sometimes they are a little bit reluctant to say, yes, we need to take their keys away. But there is a program where a parent, an elderly person, can go and be retested to see if they are able to be safe behind that wheel. And a lot of times they are, and then in times that there aren't, then they can be safely their license taken away. So it's really a great thing to be able to do that.
And even for a home assessment, if you have parents that said, you know, I don't need that, I'm totally fine, I can handle everything, how do you get them over that threshold?
You know, based on my own situation, I know what that reluctance is like. But you have to take small steps, and you have to be kind, you have to be open, and you have to be willing. And if their parents are competent, sometimes they have to make their own choice.
Right.
So it can be hard. But again, if you have open and honest discussions with your parents, I think that's the best way to go.
We're talking with Karen Pagliaro of Independence at Home right here for Hartford Healthcare. We encourage you to ask her a question about home care needs for aging parents. Let's talk about Meals on Wheels. That's something that you get a lot of questions asking.
Absolutely.
Let's talk about that and what we offer.
Sure. So right now, Hartford Healthcare at Home, we do have a grant program where we're able to provide Meals on Wheels. It's in a geographical area, and also it has to be what's the word that I want? It's driven by finances. In other words, a person has to have a certain income level. It's actually a bridge program, but what's great is we're able to provide 2 meals a day, 7 days a week, and it's anywhere from 2 weeks to 3 months, and it's free of charge based on the grant. So that's really great. There's a lot of Meals on Wheels programs out there.
Right.
A lot of them look at the different types of diets that people have, whether it's low sodium, a cardiac, or diabetic diet. And we're just a phone call away if you have somebody who even just needs meals for a short period of time, say following a hospitalization. It's just a phone call away, and if they qualify and live in that geographical area, we're able to help.
Yeah, and assessment can be done there too as well,
Right.
to figure out their nutritional needs and
Yep.
what they should be eating. And that in and of itself is valuable
Exactly.
because it's so important at that age, at that older age, that you are getting your nutrients and eating
Right.
what you should be eating. There are home health aides that come into the home and
Yep.
assist as well.
Yes.
If that is needed. Let's talk about that.
So if a person has a need to have help with a bath, there is private duty companies that can provide a home health aide or a PCA to come in and provide bathing, assistance with bathing. The other thing is if somebody has certified home care, then you can have a home care aide under, say, Medicare, but that's not a permanent solution. Medicare looks at that like long-term bathing as custodial care, and they do not pay for it. So there are some other agencies in Connecticut that can assist, like Connecticut Community Care Incorporated. And then if somebody's finances are low, we have the Medicaid program too that can help with that as well.
What questions should adult children be asking as they're sort of doing their research and looking at different companies or different assisted programs, assisted living programs? What questions should they be asking? Because as you say, knowledge is key. What should
Correct.
they be armed with going in?
So one of the things for private duty companies, you want to ensure that the person that's coming out and spending time in your parents' home has had a background check. You want to know that that person can be trusted with your parents alone in their home. The other thing, when it's certified care, we have something at Medicare.gov where you can go and there are ratings for the different agencies. So you can plug in a town here in Connecticut, it'll pull up the agencies in that town and you could look and see their ratings. I think word of mouth is great too. You can talk to your friends and neighbors and see who have you had, because if somebody's had a great experience, then likelihood is you'll have a good experience too.
Yeah, and I think what's unfortunate is that sometimes you hear a lot of negativity around certain places, and it is fearful for folks, and it can be a fearful process because they don't know where to turn or who to trust. So I think it's important to really do that research when you have the time and ask the appropriate questions, right? Would you?
I totally agree, because again, you don't want to wait until it's a crisis and then you're like,
you're desperate.
Exactly.
Yeah.
So it's always better to think ahead and think, who should we have help when we need it? And it's always better to do your homework and be prepared.
Excellent advice, Karen
Thank
Pagliaro.
you.
We thank you so much
Thank
for sharing your
you.
time with us. And as always, thank you for listening in. And we hope you got something out of tonight's discussion in terms of don't wait until the last minute. Start your research. Knowledge is key. I'm Hartford Healthcare's Tina Verona. We'll see you back here next week.